Hi, and welcome back. In Module 1, we covered a broad definition of all of the different ways that people can experience trauma. We also discussed the physical and mental effects of traumatic experience. Now, I want to give you some more specific tools about what those effects can look like and how you can respond to them. During this module, we'll review what traumatic symptoms are, discuss the benefits of symptom education with survivors, and look at what you can do with the information. The more you can recognize what's happening with a survivor, the more you can measure your own expectations about the work you can do, the help a person needs, and you can target your energy more to directly address what's happening. There are 3 common symptoms of traumatic experience. These are called hyperarousal, intrusion, and constriction. We're going to start today's training by looking at what each symptom means and also how these symptoms can present. After a traumatic experience, it's common for people to experience certain symptoms. Traumatic symptoms are all appropriate reactions to danger. Examples include heightened startle reaction, reliving of memory, feelings of surrenders. These symptoms point to the same survival instincts that likely kept someone alive during a moment of danger. However, when these symptoms persist after the danger has passed and a person is safe, the symptoms trap a survivor into thinking that they are still not safe. When traumatic symptoms persist during recovery, a survivor would need to work with a mental health professional to process the experience. Otherwise, it will keep repeating. You can think about symptoms like you would another language. Symptoms are the body's way of talking, and it's saying, there's something here that we need to talk about. Until a person truly finds safety and can tell her story, the body will continue to be on guard for danger. But the danger is inside and what is unspoken. Unspoken experience comes out in panic attacks and sleepless nights, in silence and unexplainable fear, constant shame, and an inability to trust. But learning how to recognize these symptoms will allow you to negotiate your expectations, communicate what you see or experience with your team members, develop more compassion, separate a person from their experience, and use language as a bridge to connection. By doing all of this, you're going to contribute to the safety that is needed for someone to process their experience and alleviate their symptoms. Now we'll jump into defining each symptom, and we'll start with hyperarousal. This is when the human system of self-preservation goes into permanent alert, as if the danger might return any moment. You've seen this before in someone who startles easily, reacts irritably for small things, sleeps poorly, has high startle reactions, hyperalertness, nightmares, psychosomatic complaints, irritability, and aggression. Some key characteristics of hyperarousal are vigilance, which is not always waiting for the danger to return. It's believing that the danger is already here. A person constantly monitors their surroundings, including people. This can be displayed outwardly, but it can also affect the way a person processes risk, fear, and panic. For immediacy, when you rely on survivor skills, you are absorbed by living one moment at a time or doing hurricane planning, and you treat every day like it's a hurricane. And the final characteristic, abandonment, is that a person is always monitoring signs that they'll be left, that something will fall through, that they'll be let down. The person experiencing this symptom might hold on very tightly, or they may present as very detached as well. The second symptom to think about is called constriction, which is a state of surrender, a state of detached calm in which terror, rage, and pain dissolve. It's when a person's system of self-defense shut down. They have an altered state of consciousness. It's trance-like. It's a detached sense of calm. Their perceptions are numbed. Their judgment is suspended. Even their sense of time is altered. If a person is shut down now, it may be that shutting down once saved their life during a traumatic event. But later, when the danger has passed, what that symptom does is to remind the person of the time when they surrendered to danger, and instead of talking about how bad or confusing that feels, the mind just recreates the situation again and again to justify what happened. A person experiencing shutdown might let a lot of opportunities pass them by. A person in constriction might also be codependent, which is an opportunity for a person experiencing constriction to erase themselves. Codependency can maintain a state of surrender by allowing another person to control them. And finally, self-victimization. It's true that a person who is experiencing constriction has been victimized in the past. However, there are ways that we can victimize ourselves by our present-day decisions, connections, and actions. Lastly, we'll look at intrusion. Long after the danger has passed, trauma survivors can relive the event as though it were continually recurring in the present. People experiencing intrusion have flashbacks, traumatic nightmares during sleep, memories or dreams remembered only in sensations or images, unsure how to talk or explain them. Description of intrusive memories may sound a lot like a child's dream, and a person may continually reenact their circumstances. A person experiencing intrusion can be so caught up with the past that they repeat it. Generally, traumatic repetition is motivated by a subconscious desire to find resolution to a traumatic event that caused confusion and lacked an explanation. It's a person's way of actively grappling with the past. People experiencing traumatic repetition need to be connected to new experiences and gain new references for who and how they can be. When a person experiences intrusive symptoms, they're bound by memories, meaning that they're intruding into their life all of the time. It means they can't yet envision a future that reaches past the trauma. A person has no reference points for what trauma really means to them, so their life becomes defined by this terrible thing that's happened. What they need is a new definition of themselves, one that encompasses past, present, and future, but the trap of memory does not allow for that. In addition to these 3 symptoms, you can also learn a lot about what symptoms a survivor is going through and their general state of well-being by paying attention to their body language. Notice if the person you're speaking with has the inability to make eye contact, or really tense shoulders, if they're shaking their leg or their foot or both, or making themselves as small as they possibly can. Paying attention to these traits will give you a good idea about where a person is when you're engaging with them. Panic attacks are also common symptoms for trauma survivors to experience. Again, a symptom such as this is like hanging a red flag over some experience or memory that hasn't been processed and the body wants to get it out. A panic attack is the abrupt onset of intense fear or discomfort that reaches a peak within minutes. Somebody's heart will race really fast, they might be sweating or trembling and have shortness of breath as well. A trauma-informed approach takes all of this information about symptoms for what it is. Symptoms of an experience. Symptoms never reflect the person you are speaking with. They reflect an experience of trauma that person has had. It's important to remember that because these symptoms don't always make for easy conversations. Survivors can be resistant, doubtful, or skeptical. This is all very, very normal on the road to safety. So what can you do to contributing to a safe environment where a survivor can have all of these symptoms and recover? What can you do especially when the workplace feels chaotic or angry or you're constantly being met with resistance? Did you ever play freeze tag when you were a kid? Remember how when you're on base you can't get hurt or tagged? Your base. You are the unconditional safe space in another person's intense feelings of fear and doubt. You are the thing that's there when they're scared or happy or angry or doubtful. And here are some tips for creating safety while you're working with survivors. What are you doing to take care of yourself? How can you be most at peace with yourself? Do you have supervision? What do you do when you get home from a shift at work? Are you talking to others about the emotions you feel during the day, or are you keeping them private? Do you find yourself looking for ways to check out at the end of the day through food, sex, or alcohol? It's important to relax, but it's also important to pay attention to your needs because when you work in trauma, you'll one day feel the guilt, shame, and fear that survivors you work with have. When I'm engaging with trauma survivors, what I keep in mind is that no matter what is happening, If I can recognize a person's symptoms, I could also mirror the opposite of those symptoms back to them. Let me tell you what I mean by that. If someone is having intrusive symptoms about the past, I like to point to something in the here and now, like complimenting their sneakers, or a tree outside, or remarking on hunger or the smell of coffee being made. Anything that grounds the moment in the present. If someone's experiencing hyperarousal, I like to make positive suggestions for them to look out for. Vigilance means keeping careful watch over your surroundings, and I think that person would be a great candidate for a mindfulness practice. Teach them how to listen to their heartbeat. Ask them to notice how many colors are in the space around them. See if they can count how many times people in the house smile or laugh on any given day. If someone's experiencing the shutdown of constriction, I make it a point to create 100 tiny choices for them to make. Shutdown means you're not participating. So whether it's picking different nail polishes or where to sit or the background music during a group or what icebreaker we should start with, I like to engage someone in decision making to remind them that their voice counts. Trauma-informed care is a process, and while I'd like you to study the characteristics of each symptom, remember that each person will present them in new ways, and it will be a process for you to remember and recognize what they are. What you can start practicing right away is compassion for any and every behavior you suspect might be connected to trauma. And to help you, I'll share these guidelines for, in my opinion, what a trauma-informed approach really means. Do not make any assumptions about the people who you meet. Remember that you will never know what somebody has experienced. Suspend your belief around time. Something may have happened a long time ago, but if someone hasn't processed it yet, that experience will feel as if it had happened yesterday. Additionally, flashbacks take people right back to the same moment. Make room for mystery. It's common for survivors to have patches in their story that just don't seem to make sense. They're not lying or omitting or telling their story the wrong way. They're just giving you all of the information that they have right now. Pay attention to the body, both while speaking with the survivor and also knowing the body's potential as a vehicle to recovery. Helping a survivor reconnect to her body through yoga and meditation and breathing can be a really great foundation to a life of recovery after trauma. And finally, never ever waver in your belief that recovery is possible, no matter what, and that the person sitting in front of you is capable of anything that they want for themselves. Thanks for being here for this module. This week, after you listen to this, I want you to start to think about how you can separate a person from a symptom. Try to notice any behaviors that fit with this presentation and see if you could remind yourself that you are seeing a symptom of an experience. You're not seeing into a person quite yet. See what you can do in those moments now that you have new information.